Jeff, you are wanting to make sure people understand not to go to the emergency room when they're having a dental problem, because you are ready for these patients at the different offices, aren't you?
Absolutely. It's always important not to waste the emergency room resources with dental emergencies, but it's particularly important in this pandemic environment we're in, where we are short on the protective gear for the hospital workers, and we don't want to jeopardize the patients by having them go into an emergency room that might have virus patients waiting for treatment there.
You were saying there's some numbers there you want people to understand about, because your little cyst is not that important to go to the emergency room. It's better to go to the dentist.
Well, any dental emergency is best to go to the the dental office. 45 out of every 1,000 emergency room visits are for dental emergencies, and there's not a thing that the emergency room can do. All they can do is gear up by using all that valuable PPE that we hear that is so important with the doctors right now, and the doctor can prescribe antibiotics and painkillers, and that is it. Then he has to refer that patient on to a dental office that can do the actual procedure. So it is a complete waste of resources and the patient's time to go to the emergency room. They need to go to a dental office.
Yeah, and doctor, we know that the dental offices are some of those essential offices that people need to go to, because your teeth are very important to your health, especially right now. Am I right?
Very much so, and it's an opportunity we have right now to help the community. We are focused on only providing the emergency and essential dentistry that people so much need. We have specific protocols in place in order to help make sure that it's a safe environment for patients and for our staff, doing everything that we can to help alleviate the influx of patients at the emergency rooms.
Yeah, and you want them to give a call to you before they actually stop by or make those appointments. Give a call and give the symptoms they have, because it might be something very easy that you could take care of over the phone. Am I right?
Very much so. We love screening patients over the phone. We are practicing social distancing. We want to be able to ask them, what are their current symptoms? Have they traveled? Are they experiencing any signs of fever? If we can do that over the phone, obviously that is much safer. So we prefer a phone call. We also accept walk-ins, though. We understand that emergencies, they're not convenient. And so we want to be flexible to help the patients in any way we can, but doing so in a safe manner.
Yeah.
Specific things that we're asking our staff to do when a patient comes in, we do screen them. We take temperatures. We're asking the medical history questions. We're asking patients to wait outside and not in our lobbies. We're also asking our staff to encourage proper hygiene, making sure that everyone's washing their hands, wiping down the surfaces, making sure that everyone's just doing their part to prevent the spread of the coronavirus.
Yeah. Jeff, we want people to know that the offices are open, as we just said, but what's any other thing you want people to know about what you're doing to help the community?
We really want to be part of the solution. It's so easy to freeze in a situation like this, where you just add to the problems. And 80% of the dental offices around Phoenix have closed and are not taking any patients on a regular basis. We're open at 9 a.m. every morning to make sure that, again, we're part of the solution. That's the key part. That's the message we want to send.
I like it. It's very important. We have information on aztv.com of the different locations to make sure, again, your teeth are very important to your health right now. We want to make sure people are getting that taken care of. So thank you.
Great. Thanks for having us.
Appreciate your time.